What's going on, everybody? My name is Eli and welcome back to my YouTube channel. Today I wanted to bring a quick video for those who are applying to residency programs. As you know, the IDEA Pass opens on May 8th, 2024 for this cycle. And I had the pleasure of Dr. Aris Davis doing a short video on how to apply to periodontics residency. So I don't have much to say. Dr. Aris Davis will do all the talking in this video. But if you're new to the channel, please make sure you subscribe. Dental school vlogs, residency vlogs, etc. You can find them all here. And without further ado, here's Dr. Aris Davis.
Okay, so how to apply for periodontics residency. Now, first of all, you need to be in dental school. You do have to get a degree from a U.S. accredited university in order to apply to become a periodontist, right? To apply for perio residency. There are probably about maybe high 50s to 60 or so perio programs. There aren't a ton. Honestly, I may be wrong about that. It may be less than that because I think it's that many dental schools, but whatever number it is, it's not a lot. It's very competitive and more people are applying to the specialty. So it makes it even more competitive, which is a factor as to why I end up applying twice. You do have to go on the IDEA Pass website. So we all know the IDEA website when we apply to dental school, but the Pass website is for postdoctoral residency programs that participate in the match. Now, every perio program does not participate in the match system. That's something that I did not know. Off the top of my head, I know Harvard doesn't. I cannot think of the other schools that do not. Think Ohio State, maybe. I may be wrong, but a couple programs don't, so look into that. Those programs are kind of how it used to be. Like my mentor, who's a periodontist, she applied directly to programs and they all called her at different times and let her know when she got accepted. But now with match, it's pretty much like medical match where you rank programs and they rank you. And based on the algorithm, that's where you go, right? So you apply to IDEA Pass. Of course, there's a whole application packet you have to have with different components. So you have to have letters of recommendation, of course, your transcripts, things like that to validate. There are a couple questions on there, stuff like that. And then when you apply, you'll get offered an interview to different schools that would like to offer you interviews. And then from there, you interview and rank where you want to go. And then they'll rank you and hopefully you match. Now, some factors about the application I want you to consider. Letters of recommendation. So the first time I applied, not granted, again, this is just my opinion. This is not coming from any representative or anyone giving me, any legitimate advice. This is just me speaking off of my experience. The first time I applied, one of my letters of recommendation was from an oral surgeon. One was from a public health professional. She wasn't a dentist. And another was from a periodontist, right? Now, I think letters of recommendation really come into play, and things you should consider are, one, try to stick to the specialty as much as possible. The second time I applied, I only had letters from periodontists recommending me, right? Because although those letters are speaking to you as an applicant and how good you are, think about, you want someone in the profession to speak and vouch for why they would recommend you to enter their profession, knowing what they know, knowing what they practice, and knowing what they trained under and what they went through. I do feel like sometimes perio applicants with oral surgery letters of recommendations may come off as a red flag and maybe like you wanted to be an oral surgeon but you settled for perio kind of thing, right? Which is really ridiculous. But I've heard that before. That was one thing someone told me when I talked to them and reached out when I didn't match. What do they think? And they recommended, it was like, I've literally heard people say they kind of frown upon that. So just stick to mostly perio. So if you can, try that. It may or may not make a difference, but try that. If you can't get a periodontist, try to get someone that's like from that program or associated with that program in some type of way to recommend you. If you're in a school that has a program, definitely start working on that relationship as soon as you know you want to go into perio, and see if you can get someone to recommend you and really speak to your character for that program. So give a little extra oomph to letters of recommendation. I'm not saying that, they're an end all be all, but they are a factor, obviously, in your application. Grades. So I was ranked pretty highly in my class when I applied. I was within the top 10 of my class when I applied. I think that it matters, but not 100%. I know people who were, nowhere near the top of their class that matched and I didn't. Not into just perio, but like into different specialty programs. So I say that to say, of course, didactically do your best and academically do your best, but don't let it deter you if you feel like, oh my gosh, like I'm not, at the top of my class. I'm not in the Dental National Honor Society. I'm not all these things. Like, it's so much more than your GPA. The same as in your undergrad GPA doesn't always translate into your dental school experience. Like, I didn't have the highest undergrad GPA. I graduated with a very high GPA in dental school. It's not making a difference on how I place the implant. I'm sorry. It's not making a difference on how I, select the case or how I diagnose perio. It's not even a factor. Some programs really take that into consideration. I do think my program is one of those. Like, you do have to have over a certain GPA for my program in order to consider you, but that's her personal preference. That's not everybody's preference. So that's a question you can ask when you interview or when you extern at programs. Like, how much does GPA factor in to, me as an applicant? And then if you're not that strong of an applicant as far as GPA, try to be involved in other things. Research is always great. Obviously, you're going to go into perio and learn everything you need to know. You don't know everything, and they don't expect you to know everything sometimes. But that's a conversation for another day. So yeah, if you show some interest, like you did a research project on non-surgical therapy, or you did a research project on, Indigain, some type of material that periodontists use, and you wrote a paper about it and presented it to your school. That shows interest. That shows that, you're learning about perio and all those great things. So I would recommend that. What else would I recommend? Letter of interest. I think you have a personal statement. My first personal statement was me talking about being a first-generation dentist and all the struggles that came with that, all the unanswered questions, the lack of finances, the lack of resources, but I persevered and made it through. And in my UNC interview in my first cycle, someone actually mentioned that, and they were like, congratulations to you. He's actually like a very renowned periodontist. He interviewed me. I want to say, actually, he may have passed away a couple years ago, but very nice guy, and he actually read that and paid attention to it. My second personal statement talked about me not matching and how devastated I was and how I felt like I did everything right, but then I didn't match, and I was just so heartbroken. So I talked about how that just cemented in me that I know perio is what I want to do, and that no matter how many times it took, I would persevere and I would become a periodontist. So just make sure that your personal statement is truly personal. You don't have to make up a story or, say you fought cancer to do whatever. Just be yourself, be honest, and talk about why you truly want to be a periodontist. And it's okay if you kind of don't know, you're interested and you want to be it, but you're not cemented in it. Because trust me, I've had valleys in my residency where I'm like, ooh, this is a lot. I wish I was collecting the check right now, But I think forward 5-10 years down the line, what do I want my 8 to 5 to look like? What do I want my week to look like? I have those patients that come back and I can see that they're listening to what I'm saying. They're cleaning their teeth. There's not calculus everywhere. I have those rewarding moments and I'm like, okay, I'm reminded. I got it. I only have a year left, so we almost there. So yeah, personal statement, letters of recommendation, grades, get it in on time. The cycle opens on May 8th. That is so crazy. It's coming so soon. But it's open for I think until June 14th or somewhere around there. So good luck to anybody who's applying. Definitely connect with me at Dr. Air Davis on pretty much everything. And then I'll put my email as well in the description box as well. Just reach out, let the girl know, because I'm here to help in any way that I can. If I don't respond immediately, charge it to my head and not my heart. Okay, life be lifing. What else is there? So we talked about what perio is. We talked about my journey just a little bit in the application cycle. And lastly, some words of motivation. Just know and remember, if I could go back and tell myself anything in the application cycles I went through, is what is for you is meant for you, and you will be exactly where you're meant to be. There are so many times that in this journey that I prayed for, I've been challenged, I've cried, I've been so upset, I've questioned myself as a practitioner, as a person. But I'm realizing more and more on this latter part of my journey that I'm exactly where I'm meant to be, around the people that I'm meant to be in. I'm in rooms talking about procedures and interacting and networking with people that not every dental professional can. I'm making a name for myself. I'm carving out my own space in perio, and that's important, and that's bigger than me. Your journey is not just about you. It's about the patients that you'll treat. It's about you absorbing all of this information and being a sponge so that you can truly go out and heal and impact. And I believe whether you're the perfect applicant, whether you have the perfect grades or the bottom of the barrel grades, barely made it through dental school, None of that matters. What matters is that you stay committed, you stay true to yourself, you stay confident in yourself, and you give yourself grace. Trust me, this is me talking to me because I don't give myself the grace that I need to. But give yourself grace and know that no matter how many times it takes, no matter how hard it is, no matter if someone else gets opportunity and you don't, everything is going to fall into place when and how it should for you. I truly believe that. So good luck to anybody applying. I hope this message hits somebody and they're like, I want to be a periodontist, and they become one. Please let me know if it does, because I'll be so happy to say that. But I welcome all into my great specialty, and I hope that this video helped you. If there's anything you need from me, be sure to reach out. I'll chat with you soon. Bye. Thanks for watching.